It is an honor to be here for this Ayurdarshan Conclave 2025. I am the Dr. Bruno Renzi. I am a psychiatrist and psychotherapist, and I started to study Ayurvedic medicine in 1980 at MIU, Maharishi International University in the United States, when Maharishi Mahesh Yogi decided to enlive the Ayurvedic medicine for Western doctors. It was the first course, full-time, of an hour in Ayurvedic medicine. And since the first moment, I understood that the importance of the knowledge of Ayurvedic medicine, especially in the field of prevention and promotion of health, because you know that we have two main sections. One is, in Ayurveda, we have two main sections. The first is prevention and promotion of health through the holistic approach. And the second is the treatment of disease. And Ayurveda is mainly a psychosomatic approach, because all the different dimensions of the individual life are present, starting from soul, from consciousness, from the individual consciousness, then there is the ego, then there is the body, the behavior, and also the environment. All these dimensions are present when we organize a treatment, a holistic treatment for our patient, in which we guide them in just to create balance inside their physiology. And in the year 2020, I started to organize inside a public hospital and university in Milano a psychosomatic department. It was the first experience in Europe in which the Ayurvedic medicine was integrated inside a psychosomatic department through the integrated approach with modern medicine inside a public institution. And after that experience, I understood the importance just to educate them, to give this knowledge to the doctors, to doctors, mainly psychologists and psychiatrists or healthcare professionals. And so I created this course that is Maharishi Ayurveda Integrated Approach to Psychosomatics for treatment of distress, mild anxiety, and mild depression. And we gave 2 editions of this course in South America, and now we are giving the 3rd edition here in Europe. At the same time, also in the line of promotion of health and prevention, we are organizing a family health course, because it's very important just to treat also the health of family, just to create a health society. And as you know, the World Health Organization is emphasizing a lot the prevention and promotion of health and the integration of complementary and alternative medicine in the field of sanity. And so we are promoting all these educational activities just on this line. So one very important aspect is just the integrated medicine, the integrative medicine, just in which we integrate complementary medicine, or just Ayurvedas in this case, with modern medicine. But now there is a new challenge, that is the integration of the artificial intelligence in the field of medicines, and especially also in the field of complementary and alternative medicine, or in the field of Ayurveda. But we have there some positive benefits and potential risk, and also there some ethical consideration. Among the positive correlation, one aspect can be personalization of treatment, through the analysis of a large amount of data and the patient history. So through this integration of all this data, we can create just a more personalized treatment for our patient. Another important aspect is the field of research. And the artificial intelligence can accelerate the research in the field of alternative medicine by analyzing experimental and clinical data, and we can identify also new line of treatments. But what is important is just this computational aspect, this integration of all this data. Another aspect is the predictive diagnosis through the analysis of laboratory data and patient history. So artificial intelligence is can help a lot in the doctors just through all this activity. And another aspect that is more social is the accessibility, because artificial intelligence can enhance the accessibility from the general public to the information about the complementary and alternative medicine. But there are also some controversial aspects. One is the use of artificial intelligence can lead to an over-optimization of treatments, neglecting the importance of human interaction and the doctor-patient relationship. We know that in the field of medicine, one important aspect of therapy of all the complex reality of the treatment is the doctor-patient relationship. And sometimes there are some aspects that are so subtle that only in that specific relation can be analyzed, and where also the intuition of the doctor and the capacity of understanding of the doctor is important. Then we have a risk of technology dependence. The patient can become overly dependent on the artificial intelligence and can reduce the attention to the doctor recommendation. And we know that many times the recommendation from the doctor are due to a very large amount of experience on the field. And there is another problem that is the security, the data security is another aspect relating to the personal data of the patient, that we don't know who control this aspect, all this very personal aspect related to the privacy. So in conclusion, I think that it's essential to address the associated challenges and risks, and such as data privacy and the importance of human interaction. So all these aspects are very important. And so the key to an effective implementation will be finding a balance that maximizes the benefits of artificial intelligence while maintaining the integrity and also the ethics of the complementary and alternative practices. So thank you for your attention.